I want you to do something right now. Take off your socks. Look at your feet, both of them, carefully. Because what I am about to show you in this video are specific changes that appear on the feet. Changes in color, in swelling, in skin texture, in nail appearance, in temperature, that are among the most reliable early warning signs of serious conditions that are silently developing inside your body right now. Your feet are the farthest point from your heart, the last destination of your circulation. The first place where problems with your blood vessels, your nerves, your kidneys, your heart, and your liver become visible on the outside of your body. I have been practicing vascular medicine and internal medicine for over 22 years, and I tell every senior patient who comes through my door the same thing. Look at your feet every single morning. Not because feet are important in isolation, but because your feet are the window into what is happening inside your entire body. In this video, I am going to show you 7 specific foot warning signs that require immediate medical attention. I will explain exactly what each sign looks like, what condition it signals, and exactly what to do when you see it. Please, while I describe each sign, actually look at your own feet right now, because the earlier these signs are recognized, the more options are available. Tell me in the comments, when did you last look carefully at your feet? Type your answer below. Most seniors say they never look. After this video, that changes. Before the 7 warning signs, you need to understand why the feet reveal so much about internal health, because this biology makes everything else make sense. Your feet are the end of the line. Your cardiovascular system must work against gravity to deliver blood to your legs and feet, and then work even harder to return that blood back up to your heart. Any weakness in your heart, any narrowing in your arteries, any inefficiency in your veins is amplified at the feet, where blood must travel the farthest and work the hardest. Your feet have the longest nerves. The nerves supplying sensation and movement to your feet are the longest peripheral nerves in your body, running all the way from your lower spine down through your legs to your toes. Long nerves are the most vulnerable to damage from diabetes, nutritional deficiencies, toxins, and inflammatory conditions. This is why nerve damage, neuropathy, appears in the feet long before it appears anywhere else in the body. Your feet show fluid balance. When your heart, kidneys, or liver are not functioning efficiently, fluid accumulates in the lowest part of your body due to gravity. Your feet and ankles are the first and most visible place this excess fluid appears. After 65, the stakes are higher. Peripheral circulation naturally declines after 65. Nerve sensitivity decreases. Skin becomes thinner and less resilient, and the ability to heal from injuries slows significantly. This means that foot problems that would be minor inconveniences at 40 can become serious, even limb-threatening, at 70. A study published in the Journal of the American Podiatric Medical Association found that foot examinations in adults over 65 identified previously undiagnosed serious medical conditions, including peripheral, arterial disease, diabetes, and heart failure. In over 30% of cases, 30% of seniors had a serious condition their feet were already showing that nobody had noticed. Now the 7 signs. Please look at your feet as I describe each one. Warning sign 1. Swelling that does not go away. Look at your ankles and the tops of your feet right now. Press your finger firmly into the skin just above your ankle bone and hold for 5 seconds. When you release, does the indentation remain for several seconds before the skin returns to normal? This is called pitting edema, and it is one of the most significant foot warning signs for adults over 65. When you press on normal tissue and release, it springs back immediately when fluid has accumulated in the tissue, filling the spaces between cells. The indentation remains because the fluid is slowly displaced by your finger and slowly returns. Pitting edema in the feet and ankles has 3 major causes in seniors, and all 3 require medical evaluation. First, heart failure. When your heart is not pumping efficiently, blood backs up in the venous system. Fluid leaks from the veins into surrounding tissue. Because the feet and ankles are lowest in the body, gravity concentrates this fluid there first. A study from the American Heart Association found that ankle swelling was present in over 70% of seniors with heart failure, and in many cases it was the first visible sign. Second, kidney disease. When kidneys cannot efficiently remove excess fluid from the body, that fluid accumulates in tissues. The feet and ankles are typically the first and most obvious site of accumulation. Third, liver disease. The liver produces albumin, a protein that keeps fluid inside blood vessels rather than leaking into tissues. When liver function declines and albumin production falls, fluid leaks from vessels into surrounding tissue, appearing first in the feet and ankles. If you notice swelling, that is present when you wake up in the morning, not just after a long day of standing, and that leaves an indentation when you press it. This requires physician evaluation this week. If the swelling is sudden, severe, or accompanied by shortness of breath, go to emergency services immediately. Warning sign 2. Color changes: blue, purple, or pale white feet. Look at the color of your feet right now, particularly the toes and the soles. What color are they? Normal feet should be a flesh tone, consistent with your overall skin color, perhaps slightly pinker when warm and slightly paler when cold. 3 abnormal color patterns are serious warning signs. Blue or purple feet, particularly toes that appear consistently bluish or purple, indicate cyanosis. This means your blood is not carrying enough oxygen to your extremities. Causes include heart failure, chronic lung disease, or severe peripheral arterial disease where circulation to the feet is critically reduced. Pale or white feet. Feet that appear unusually white or lose color entirely when you elevate them above heart level indicate poor arterial circulation. A simple test called Buerger's test can be performed at home. Lie on your back and raise both legs to a 45-degree angle for 60 seconds. Healthy feet maintain their color. Feet with poor arterial circulation turn pale or white within those 60 seconds as the compromised arteries cannot maintain adequate blood flow against gravity. Mottled or blotchy skin. A patchy pattern of purple and pale areas across the feet, called levato reticularis, can indicate autoimmune conditions, blood clotting disorders, or cholesterol embolism, where small cholesterol crystals break off from arterial plaques and block tiny blood vessels in the skin. Any of these color changes, particularly if new or progressive, warrants physician evaluation. Blue toes combined with any shortness of breath is a medical emergency. Warning sign 3. Non-healing wounds or sores. Look carefully at the soles of your feet, between your toes and around your heels. Are there any open sores, wounds, cracks, or areas of broken skin that have been present for more than 2 weeks without healing? Non-healing wounds on the feet are one of the most serious foot warning signs in adults over 65, and one of the most common pathways to devastating outcomes, including amputation. 2 conditions make foot wounds non-healing in seniors. Peripheral arterial disease. Narrowing of the arteries supplying blood to the feet reduces the blood flow that delivers oxygen and nutrients needed for wound healing. A wound that would heal in days in a healthy adult with good circulation may not heal at all in a senior with severe peripheral arterial disease. Diabetic neuropathy. Nerve damage from diabetes that reduces sensation in the feet. Means that wounds can develop from pressure, friction, or injury without the person feeling any pain. The wound is not noticed until it has been present for days or weeks, by which time it may already be infected. A study published in Diabetes Care found that foot ulcers are present in approximately 15% of diabetic adults at any given time, and that they precede 85% of all lower limb amputations in diabetic patients. The critical finding was that early detection and treatment dramatically reduced amputation rates. If you have any open wound on your foot that has not healed within 2 weeks, particularly if you have diabetes or known poor circulation, do not treat this at home and do not wait for your next regular appointment. See your physician this week. Warning sign 4. Numbness, tingling, or burning sensation. Do your feet feel numb when you walk? Do you experience a burning or tingling sensation, like pins and needles, in your feet, particularly at night? Do you sometimes feel like you are walking on cotton wool or on a surface that feels wrong beneath your feet? These sensations, or the absence of normal sensation, are the hallmark symptoms of peripheral neuropathy, nerve damage in the feet and legs. Peripheral neuropathy in adults over 65 has several major causes. Diabetes is the most common, affecting the long nerves of the legs and feet through a combination of high blood sugar toxicity to nerve tissue and reduced blood flow to the tiny vessels supplying the nerves. But diabetes is not the only cause. Vitamin B12 deficiency, extremely common in seniors over 65, particularly those on metformin for diabetes or proton pump inhibitors for acid reflux, directly damages the myelin sheath insulating nerve fibers. Thyroid dysfunction, kidney disease, alcohol-related damage, and certain medications, including some chemotherapy agents and some antibiotics, can all cause peripheral neuropathy. A study published in the Journal of the Peripheral Nervous System found that peripheral neuropathy was present in approximately 26% of adults over 65, and that in over 30% of those cases, the underlying cause was treatable or reversible when identified early. If you have persistent numbness, tingling, or burning in your feet, ask your physician specifically for a neuropathy evaluation, including blood tests for B12, thyroid function, blood sugar, and kidney function. Warning sign 5, cold feet that never warm up. Touch your feet right now. Are they cold? Noticeably colder than your hands? Colder than the rest of your body? Even when the room is warm and you are wearing socks? Persistently cold feet in seniors. Feet that feel cold, regardless of ambient temperature, that do not warm up with socks or blankets, that are noticeably colder to the touch than the rest of the body, are a classic symptom of peripheral arterial disease. Peripheral arterial disease, PAD, is the narrowing or blockage of the arteries supplying blood to the legs and feet. In adults over 65, PAD affects approximately 12 to 20% of the population, with rates even higher in those with diabetes, hypertension, high cholesterol, or a history of smoking. And the majority of people with PAD have no symptoms other than cold feet, making it one of the most under-recognized cardiovascular conditions in older adults. PAD is not just a foot problem. It is a marker of systemic arterial disease. Adults with PAD have significantly elevated rates of heart attack and stroke because the same arterial narrowing affecting the leg arteries is typically also affecting the coronary and carotid arteries simultaneously. A simple clinical test called the ankle brachial index, ABI, compares blood pressure at the ankle with blood pressure at the arm. A result below 0.9 indicates significant peripheral arterial disease. This test takes minutes, is painless, and is available at most physician offices. If your feet are persistently cold, particularly if combined with leg pain when walking, that resolves with rest, ask your physician specifically for an ankle brachial index measurement at your next appointment. Warning sign 6, nail changes. Thick, yellow, or crumbling nails. Look at your toenails now. Are they thick, yellow, brittle, crumbling, or pulling away from the nail bed? Toenail changes in seniors have two primary causes, each with different clinical significance. Fungal nail infection, onychomycosis, is by far the most common cause of thick, yellow, brittle, or crumbling toenails in adults over 65. It affects approximately 50% of adults over 70. On its own, nail fungus is not medically dangerous. But in seniors with diabetes or peripheral arterial disease, untreated nail fungal infection increases the risk of bacterial infections spreading to the surrounding skin and deeper tissues, creating a portal of entry for infections that can become serious very quickly in poorly circulating feet. But there are nail changes that go beyond simple fungal infection. Clubbing of the toenails, where the nail curves dramatically downward over the tip of the toe, indicates chronic low oxygen levels and can reflect heart failure, chronic lung disease, or liver cirrhosis. Spoon-shaped nails, where the nail curves upward like a spoon, indicate iron deficiency anemia. Completely white nails, Terry's nails, as I described in my liver skin signs video, indicate low albumin from liver disease. Have your physician examine your toenails at your next appointment, not just your podiatrist. Toenail changes can provide important diagnostic information that goes beyond foot health. Warning sign 7, sudden severe foot or leg pain at rest. This final warning sign is the most urgent and the one that requires the most immediate response. Rest pain, severe pain in the foot or toes that occurs while sitting or lying down, particularly pain that is worse at night and that is partially relieved by hanging the foot off the side of the bed or standing up, is a medical emergency. Rest pain is the clinical hallmark of critical limb ischemia, the most severe stage of peripheral arterial disease, where blood flow to the foot has been reduced to the point where it cannot maintain tissue viability even at rest. Without urgent treatment, which typically involves vascular surgery or catheter-based procedures to restore circulation, critical limb ischemia progresses to tissue death and gangrene within weeks to months. The reason hanging the foot off the bed temporarily relieves the pain is that gravity assists the limited blood flow, briefly improving circulation to the ischemic tissue. This positional relief is a diagnostic feature that confirms the vascular origin of the pain. If you or someone you love experiences severe foot or toe pain that is worse at night, that occurs at rest, and that is partially relieved by dangling the foot, go to emergency services immediately. Time is tissue. Every hour of delay in critical limb ischemia increases the risk of permanent damage. 3 clear response levels based on what you found. Emergency. Go today. Cola-colored toes or feet. Blue or purple discoloration combined with any shortness of breath. Severe rest pain, worse at night, partially relieved by dangling foot. Any non-healing wound with signs of infection. Redness spreading beyond the wound edges. Warmth, pus, fever. Sudden severe swelling of one leg only, which can indicate deep vein thrombosis. These require emergency services or same-day emergency care. Do not drive yourself if you are in severe pain or short of breath. Urgent. Physician this week. Pitting edema present in the morning. Consistently cold feet that never warm up. Any non-healing wound present more than 2 weeks. Persistent numbness or burning in both feet. Feet that turn pale or white when elevated. These require a physician appointment this week, not your next routine checkup. Important. mention at next appointment. Mild intermittent tingling in feet. Toenail thickening or discoloration. Mild swelling present only at end of day that resolves overnight. These should be specifically mentioned at your next physician appointment with a request for appropriate testing. 4 steps, starting right now. Action step 1. Right now, after this video, do a complete foot examination in good lighting. Both feet. Check color, swelling, wounds, nail appearance, and temperature. Press your finger above your ankle bone for 5 seconds and check for pitting. Write down anything you notice. Action step 2. Every morning starting tomorrow, spend 60 seconds looking at your feet before you put on socks. This daily habit catches changes early, when early intervention is still possible. Action step 3. At your next physician appointment, ask specifically for a foot examination that includes checking your circulation with an ankle brachial index, checking your sensation with a monofilament test, and examining your nails and skin. This comprehensive foot exam takes 10 minutes and should be standard for every senior over 65 annually. Your feet have carried you through your entire life, every step, every mile, every dance, every morning you get out of bed. And they have been trying to tell you something through color, through swelling, through sensation, through the wounds that do not heal, and the coldness that does not go away. You now know what to look for. 7 signs, visible to the naked eye, available to check every single morning before you put your socks on. Start tomorrow morning, 60 seconds, both feet, in good light. Because the earlier these signs are recognized, the more your doctors can do. And because the feet that have carried you this far deserve the attention that could keep them carrying you further. If this video gave you something genuinely valuable, please subscribe. Every week I bring you senior-specific, clinically grounded health information that fills the gap between what your doctor knows and what you deserve to be told. Hit the like button if this made you look at your feet differently. Leave a comment. Did you find any of these 7 signs just now? I read every single comment. Thank you for watching. Look at your feet tomorrow morning. They have been waiting for you to pay attention.